Good evening and welcome to Plain Talk. Thank you very much for joining me this evening, Christopher Ram, as we discuss another topical issue. As you will see from the screen, it's a COVID-19 update, and we have once again Minister of Health, Dr. Frank Anthony, who has appeared on the program before to talk about COVID. I guess, Dr. Frank, we might have hoped that you were coming to announce the end, but it doesn't seem that way at all.
No, it doesn't. Well, thank you very much for having me on the program once again. As you said, the topic is very topical, and hopefully we'll be able to discuss different aspects of the response to COVID and get more people to take it seriously.
Yes, that must be very frustrating. What's called vaccine hesitancy. We'll get to that though. Now, in the press this week, you reported the news, I should probably say grim news, of 36 fatalities in 1 week. Yeah. Is this situation spiraling out of control?
Well, it's not out of control, but unfortunately, what we're seeing right now is what we'll call a Delta surge, meaning that we have the Delta variant that is circulating, and with that variant, it's more transmissible. And we are going to see a lot more cases, and unfortunately, with a lot more cases, we are going to get more hospitalization and deaths. Most of the persons who have been coming into the hospitals have been persons who are unvaccinated. So if you're unvaccinated, you have a higher risk of when you get COVID that you'll end up in the hospital, you'll end up in the ICU, and you can die from
the chances
COVID.
Of death are higher.
Yes. So that's what we're seeing. As of today, over the last 24 hours, we've had 313 new cases. And that's from doing about 2,200 tests. So we had 313 cases, and it's right across Guyana.
About 1 out of 7.
Yeah, and in Region 4, now we have close to 2,000 cases in Region 4 alone. Georgetown, we have a very high number. East Bank, East Coast. So again, it comes back to doing the basics, and the basics really is people have to wear masks, they have to do the social distancing, and of course, get vaccinated, because that vaccine can really save your life.
Sometime last year, before these variants that now carry the Greek alpha, beta, gamma, and delta, with some strange sounding numbers as well. But before the variants surfaced, it was felt that the vaccines and the related measures, you talk about social distancing, hand washing, etc., would see the end of COVID-19. We have now gone through, as we said, the 4 separate variants with no end in sight. How do you, as a medical man yourself, and the government view this situation? How serious do you now think, if one were to put it in level, with level 5 being the worst and 1 being okay, tolerable?
So look, the virus is going to mutate, and we have seen those mutations happening. So from the original strain that was found in Wuhan, we would have seen you getting the beta and the gamma. Now we have delta that is right now circulating across the world. And those are what you call variants of concern. You also have variants under investigation because they haven't gotten to that level yet. And you have a number of those, including Iota, Epsilon, and the more recent one, Mu. Mu it's circulating already in the Caribbean. There are about 32 cases of new in the Caribbean. That one, originally, they found the first set of cases in Colombia, and that has now started circulating to different countries. But Delta is the one that has really been affecting countries. You would have seen what happened in India. Then you saw what happened in the UK. Now, this variant is more transmissible. So for every one person that is infected, potentially that one person can infect 9 others. And that's going to see more cases happening. And what we have found with this particular Delta variant is that it's also affecting children. So in the past, with other variants, we didn't see much. You get infected, but you had milder presentation of the disease in children. With Delta, you have a number of children who would get the severe form of the infection. And that's why we have to come back to vaccination. Now, even with Delta, once we have high levels of vaccination, we would be able to get closer to herd immunity. Right now, for first dose vaccines in Guyana, with our adult population, we are about 65% first dose. But we noticed that people who receive their first dose, many of them are not coming back for second dose. And so while we are at 65% first dose, we are about 33% for the second dose.
And those are persons who have gone through the waiting period to get the second dose?
Right, so we have right now, so we are giving 4 vaccines right now.
Yes.
We have AstraZeneca. So AstraZeneca, your second dose, you can come back anytime between 4 weeks to 12 weeks to get that second dose.
Yes.
We have enough second dose AstraZeneca right now available to give anybody who took the first dose. They can come and get that second dose.
Yeah. Once they pass the 4 weeks.
Once they pass the 4 weeks. We also have been using Sinopharm, that's the Chinese vaccine.
Yes.
And with that vaccine, after your first dose, 28 days after, you get your second dose. Again, we've had people who took the first dose but haven't come back for their second doses yet. And again, we have that vaccine available for your second dose.
And you have percentages there as well?
We have some percentages. I don't remember them all offhand.
Okay.
We have the J&J vaccine. And
Johnson & Johnson.
Right. So that one, it's that single dose.
Yes.
So we have started using that in Region 8 and Region 7, especially in those hard-to-reach communities, because the problems that we get out there, when you go, you give the first dose, you come back to do the second dose, sometimes you can't find the people.
Yeah.
And so we thought this might be more appropriate for those areas, and we have been using it in those areas. And then, of course, we got the Sputnik V, right? We have had some difficulties with the second dose, but we are working to rectify that. And even now, the Russian Direct Investment Fund, one of the things that they're saying is that you can go up to 180 days before you take the second dose. We are trying to make sure that people within the 90 days that they're able to get that second dose. So we have been working on this, and there are lots of people, by our count, who should come back for that second dose, whether it's AstraZeneca, Sinopharm, and we have those vaccines available for them.
What do you think accounts? One can understand vaccine hesitancy being zero, people not coming.
Right.
But why would persons come and take, more than likely voluntarily, take the first dose and don't come back?
Yeah, well, that we're trying to figure out. It might be a combination of factors. One might be they feel with one dose that they're quite secure. But what we have found is that the persons with one dose from a two-dose vaccine, I like to call them partially vaccinated,
Yes.
right? So if you're partially vaccinated, you wouldn't get the full benefits of the vaccination. You have to get both doses. And we prefer people to be fully vaccinated.
Yes.
So those persons who have been fully vaccinated, they would be able to fight off the disease in a much better way. And that's why we are encouraging people to be fully vaccinated.
Lots of countries, including the United States, and Joe Biden very early o'clock thought he could get to the numbers of herd immunity. Is that still a likelihood in Guyana?
Well, it is a challenge for all countries because with the Delta variant, the target for herd immunity now has gone up, so to speak. Before, with other variants, we were looking at maybe 80-85% to get to herd immunity. With the Delta variant, most of the experts think that you will have to be like around 90% for you to achieve herd immunity. And given that some people are hesitant and would obviously not take the vaccine, it makes it increasingly difficult to get to that point. And also remember that vaccines for children, the Pfizer vaccine has only been given emergency use authorization for up to 12 years.
Yes.
So you have a segment of our population from 12 downwards that cannot receive a vaccine because none has been licensed for that age group. So when you're talking about herd immunity, you have to exclude this grouping until the clinical trials, until we see data from the clinical trials. And if that data says, well, okay, you can give to this age group, then it would increase our chances or increase the population that can get vaccinated. Right now, the Food and Drug Administration of the United States, they're expected to start reviewing data for children from Pfizer to look at ages 11 to 5. And that might start either later this month or maybe sometime next month. And once that review is completed, depending on what they find, they probably would grant emergency use authorization for the Pfizer vaccine. If that happens and when that happens, it then allows us now to vaccinate in this age range, which would be like our primary school kids here. But we have been vaccinating our secondary school children, and for the last 2 weeks we have started that process. We now close to 19,000 children would have gotten the vaccine. That's approximately like 25% of that age cohort. So that's not bad for 2 weeks work, but we still have a lot more people to get vaccinated. And again, we want to encourage parents, if you want your child to go back to school, because the whole year they've been out of school, and most kids when they're home, they're not really studying, they're not following.
And some of them quite frankly don't have the means to study at home.
Exactly. So that learning deficit that you will have would be tremendous. So if these children later on would have to prepare to go write CXC and so forth, it's going to be a challenge for them to do so properly because they wouldn't have covered the foundational material. And so it's important that we start trying to get them back to school safely, and the only safe way is if they're vaccinated. And that's one of the reasons that we've been really pushing to get children vaccinated. Parents have been cooperating because we require that they give parental consent, and they have been coming forward and they've been doing that. And I want to encourage those parents who haven't gotten their child vaccinated to come to one of the sites and let us get that vaccination done.
It must be one of the big challenges, the discussions between you, and I'm not asking you to disclose the details of those discussions with the Minister of Education, Ms. Priya Manik Chand, because obviously I actually think, and I believe there is some evidence to back it up. Once a child has lost about 3 months in school, a high percentage of that cohort of children will not go back to school.
Yeah, that's a big challenge. And, that's something that we want to correct, because it is going to be a big challenge. And imagine each year that stays out, if you're losing a percentage of them, it's going to be challenging. And when they get, if they're first formers, by the time I don't know how much they'll be able to make up by the time they get to fourth form, say to write math and English, or, that kind of thing. So it is going to be difficult. And for primary school children, the foundation that you have to lay so that you can get into secondary school. And in our system, it's very competitive, right? So if you want to be on top and try to get good grades, you have to be out there working at this, but it's going to be challenging for a lot of the children.
Do you think, given the immediacy of just dealing with the illness, may have taken away from the consideration of the long-term consequences, and not only the long on your liver, your lungs, etc., but on this question of education?
I think there are lots of experts who have been looking at the impact that COVID would have on education, and people are very worried. It's not only here in Guyana but across the world, because we're seeing this loss, what they call the educational deficit.
Yes.
And how do you recover from that? It's going to be challenging. So universities and so that close in the U.S., many of them have started reopening, but they're reopening under certain conditions, certain way of going back to school. You've got to be vaccinated. These are standard process that you have to go through, or else you can't come to school. So people recognize that you need to do this. And for some of those universities, because of the fees and all of that, if they don't reopen, they're going to go bankrupt. So they have other considerations that they have to take into account. But the education, the children's education, that would suffer tremendously. On the medical side, when people get infected with COVID, you can have a mild form. So you might not be symptomatic, you can be asymptomatic, and some people can have mild symptoms, a little bit of coughing, a little bit of fever, and that's it. But for a percentage of people, maybe about 20%, they would actually end up coming into the hospital. And these are people who are older, persons who have various comorbidities or underlying condition, diabetes, hypertension, heart disease, kidney disease, cancers, and that sort of thing. So they can end up coming into the hospital because of these underlying comorbidities. And then they have a harder time, right? And this is compounded if they're not vaccinated. But what we are also seeing is that you can have mild COVID, and about 3 months after, you think that the disease might have resolved because you didn't really have much symptoms. But you start experiencing what is called long COVID. So you don't have active infection, but the damage that this virus would have done to various organs in your body would result in those organs not functioning to the optimum. So this virus has the capacity of invading your brain, for example. And for some people who would have had, been hospitalized with COVID, even some younger people who got mild forms, they sometimes end up with brain fog, meaning that in the midst of a sentence they get confused, they're not, that sort of thing. And this happens to a lot of COVID patients. And there are other signs and symptoms that you can get. And that's just one form in which long COVID is manifesting itself. You have persons who are young and healthy before COVID, and then they present a couple months after with heart disease. All the typical signs, like if they're getting a heart attack. You have persons who end up with having signs of kidney disease.
I think those are some things we've detected in Guyana.
And we have some of those cases. So you also have people who did not have diabetes before. And then post-COVID, they start showing signs of being a diabetic. So we are confronting a disease which we are learning every day more and more about. But if people believe that, you can be casual about it, and I probably, because I'm young or whatever, I will get a milder form of it and I'll be okay, that's not the case, because you don't know whether you'll end up with long COVID, and that can be a challenge. So the bottom line here is that we have a known, proven, safe method that can help people through this, and that's vaccines, right? So we know that the vaccines, if you're fully vaccinated, it would actually decrease your chances of getting infection. You can get infected.
Or the consequences of...
Right. And then it decreases your chance of being hospitalized, decrease your chances of getting into that ICU, decrease your chance of death, right? And also can help to decrease the consequences of long COVID. So this thing got a lot of plus. So sometimes it's it's hard to understand, why is it that someone, knowing that you have these options, would prefer not to take the vaccine at all because they're hesitant. What is driving that hesitancy, right? Because if you take time to examine the information that is out there, especially from the credible source, not the stuff that people are making up, because there's a lot of make-up stuff out there, right? You got to go to the credible source and look at that, and then make the decision for yourself, because this really can make a difference to your life, right? We have had a number of deaths in Guyana, and we are now seeing, because of this Delta surge, we're going to see people dying, right? Over the last 24 hours, we had 6 deaths, right? So we are going to see that if people are not going to get vaccinated.
That's a large number. It's even worse than the 36 in 1 week.
Yeah, and again, we got to encourage people to get vaccinated. It's going to protect them.
You're talking about the long COVID, and the fact, Doc, is it true that we don't even truly know what the effect of the long COVID is, because we've only had COVID, December 2019 or sometime around then?
Yeah, but there are
so
lots
we don't know the truly long-term consequences.
Right. So many of the things now is being discovered, right? Because they're looking at patients who would have contracted COVID. What are the effects? They have many studies that are ongoing, and they're trying to figure out what has happened with people. And after active COVID or acute COVID, they get discharged, and then they come back with all kinds of other medical problems, and they try to analyze that to see and to make sense out of this. So it's an ongoing work.
I know it must be extremely annoying and frustrating and, quite frankly, maddening, the vaccination hesitancy, and one doesn't want to feed that. But even among scientists, you do have differences. I saw the news reporting that there's this question: should there be a booster shot? And Dr. Fauci, the world's face on this matter, is taking one side, and you've got some scientists taking another.
Look, basically it's an argument of equity, right? Because right now, globally, there are about 5 point something billion doses of vaccines that would have been given out. Most of those doses have been given in the developed world, right? So despite vaccine hesitancy, most of these doses were given in the developed world.
Yes.
And a lot of the poorer countries don't have as much access to the vaccines. Now, they have created international mechanisms like COVAX
Yes.
to assist poor countries in accessing vaccines. And more recently, you have the United States with their bilateral program have been donating vaccines to countries, right? So countries and these international mechanisms are trying to address some of that inequity. But even with all of that, there's still a big shortage. And so the argument from the World Health Organization is saying, hey, look, you can't go and give a third dose when you got about half of the world still didn't get one dose.
Yes.
That is very unfair. So let us try and give everybody a fair shot at this. Let us, give everybody a chance to get at least one dose. And then we can think about giving, in these developed countries who can afford it, a third dose. So that has been one of the big arguments, and the WHO has a very strong position on it about booster, but it has to do with equity. The developed world, they looked at the science, they're seeing it, and one of the things that they're saying for countries that have used exclusively the Pfizer vaccine or Moderna vaccine, that after the second dose of the Pfizer vaccine, about 6 to 8 months after, they have detected that you're getting a weaning of the immunity. So you get a drop in the antibody levels. And so because of that, they're thinking that we need to give a booster shot again. That has been demonstrated in Israel because they had vaccinated a large percentage of their population, and now they have started doing the third dose. They're about 25% of their population now with the booster shot. And the data coming out from that is that once you get the third dose, that your immunity becomes more robust. And other countries are looking at that example and want to do it for themselves. So the United States have announced that they are going to do a third dose. The UK, I think about a day or so ago, announced similarly that they're going to go and do a third dose. And other countries, I guess, would follow the same example. Because at the end of the day, I think countries also want to protect their population. Now, one of the challenges that we have with COVID is that in the unvaccinated, you are going to see more mutations of this virus. And the longer we take to vaccinate the world's population, we are going to see other variants emerging. So whether they pop up as variants of under investigation and then become variants of concern, they are happening. And that's why it's a race to try to vaccinate as much people as possible to ensure that we can prevent more variants from emerging. So, this is basically what we have to do.
One of the inevitable questions, I guess you recognize that, is that if countries are going for the booster shot and science has proven that it restores the level of immunity, what is Guyana's position?
We are examining it, but we are not there yet because we still have, as I told you,
unvaccinated.
We got 33% of our adult population just got their second dose, and while we have second dose of people, they're not coming forward. So going to a third dose would present even more of a challenge. But let's encourage people to get their first and second dose, and then we'll have that conversation, because for many people we still not past that 8 months as yet.
Yes.
Right? And also it has to do with the types of vaccine. So with the mRNA vaccine, that's where the data is in terms of booster shots. But let's say with AstraZeneca, which a totally different type of vaccine, the British haven't spoken very much about booster shots using the AstraZeneca vaccine, right? So we'll have to look at the data to see what is emerging and the robustness of the immunity that is generated by the vector types of vaccine versus the mRNA vaccines. So those are things that we constantly evaluate. We scan the academic journals and so for that type of information, and based on what is emerging in the science, then we are able to guide our response here and how we position our programming, whether we do third dose and so forth.
Given the challenges, the seriousness, has this warranted a subcommittee, say, of cabinet?
Yeah, we do have a very serious discussion pertaining to this, and
Well, my question was whether you had a subcommittee as such.
but what we have is the task force, and
Okay.
which the Prime Minister heads. I'm a member of the task force. We have a number of other cabinet colleagues who are on that task force, and we have other representatives that are on the task force. The task force has now also been expanded to accommodate every regional chairman. So they are part of that decision making, because in every region there's supposed to be a regional task force as well. So it is there, and we do have very robust discussions pertaining to what measures we should have in place, enforcement of these measures, getting people to comply, getting people to understand the need to do this or do that, and so forth. So we do have those types of discussions.
Dr. Frank, you know, there are still only a number of truly world-class specialists in something like this. How have we been able to derive the kind of state-of-the-art information? Do we have any formal or informal links with some of these scientists?
So we have, look, a lot of our local guys are very knowledgeable in a lot of this, right? So we can look at it in different ways. So from an epidemiological point of view, the dynamics of the disease and so forth, so that's one way of looking at it. Cases, how this is going to unfold, and that sort of thing. So that's one component. And then looking at the clinical part of it, so if somebody gets sick, they come into hospital, how do we treat, right? And a lot of the local doctors here, they have vast experience in doing this, although it's a new disease. The treatment, because what would happen to somebody when they get COVID, those syndromes, we have seen them in other diseases. So if it attacks your lung, we know how to treat those conditions that would affect your lung. So whether you intubate that person, you need to give them oxygen, that sort of thing. And so they know what to look for. And in the early stages of the disease, that is what they were doing. But now a lot more information is available about how the body reacts and so forth. And then what we have been able to do with research that is currently being done is to understand which types of medication will work at different stages of the disease, right? So at the beginning, when it's at the pulmonary stage or the lung stage, and then you got a hyperinflammation stage, and then you got post-COVID. So at each one of these stages, once you can define what stage you're in, you would know how to treat and what medicines to use and so forth. And you have right now a lot of investigation with newer medicines. So they're basically in two categories. You have like the antivirals that are being used. They have different types that they're working with. We are using here remdesivir because in some of the earlier studies we have seen in some conditions the effectiveness of remdesivir. Then you have some steroids, so we're using dexamethasone. There's some newer medication that is available. We don't have access to those because even in the US it's still under emergency use authorization, and it's hard to get those types of medication, and those include the monoclonal and polyclonal antibodies, and they're very expensive, right? But with what we have been sourcing it, getting it for patients, and we have been using it. And the doctors here, they are really following the science. They're up to date with the information, and they change as things change, right? If we see newer ways of treating, we adjust accordingly. And they are also in touch with colleagues in the US, in Canada, in the UK. We have, for example, Guyanese who are in the States who are treating COVID patients. They're some of the foremost specialists in some of these centers. And so they share that information. And we do have, on a regular basis, those overseas Guyanese doing seminars with the local guys here. So we share experience, and that is happening constantly. And so everybody is in touch. And we have a lot of WhatsApp group.
Yes.
Where on a daily basis things are shared. So the information is flowing, people are understanding, and there's a vibrant discussion. And we also even have, when we have a lot of, let's say, a complicated case here, that we would ask colleagues abroad to consult and to give us another viewpoint on how do we manage this particular patient. So that sort of thing is happening.
It seems that you have a very good system, particularly the center. Guyana is a large country. It's flung out. Is the same level of expertise available, given that we only have one truly specialized hospital for this purpose?
So one of the things that we have done a couple months ago is really working with PAHO, and we did standardized treatment guidelines. And then we brought all the guys in from the region who were working with COVID-19 patients, and we teach them basically how to treat a patient. If you got this, these are the conditions, this is what you do. You got this is what you do. You meet to this stage, this is what you need to do, right? So those protocols are clearly laid out. We had training sessions, and so the colleagues out in the periphery are, quite aware of what they need to do. We have also tried to equip them, so we have given them ventilators, we have given them oxygen supplies, medicines and things like that, so that if they have a patient, they know how to treat, and they have the things to treat. Now, some of those patients might be complicated, and in those cases where they feel that it's a very complicated patient, their job is to stabilize that patient and refer them into us. So basically what they'll do is stabilize, call for a medevac, we bring that patient out, patient comes to Ocean View, where we have a little bit more resource that we can use on that patient. And that's what we've been doing.
I don't know if you've heard reports that Liliendahl, in fact, is operating in excess of capacity. Is that correct?
That's not true. We have right now...
I think it's 29 bed at...
no. So we have a capacity to manage 204 patients.
At Liliendahl?
At Liliendahl. We have right now about 118 patients in the hospital, with 31 patients as of this morning in the ICU.
So it's less than 50% of capacity at this stage.
Right. We have a capacity in our ICU to go up to about 52 ventilators. So we're using about 31 right now. And I saw there were some reports saying we don't have oxygen and all that nonsense. We have worked with the oxygen company locally, and we have enough oxygen for the patients that we currently have. Now, one of the things that we have invested in with Massey is to buy a huge bulk tank. That we brought in about 3 months ago. And so what Massey does, the tank is there. They'll come every 24 hours and fill that tank. Now, if the demand for oxygen goes up, then obviously they'll have to come more frequently to fill the tank, because for some of the patients that we have in the ICU, some of them require 15 liters of oxygen per minute. There are other patients who require up to 30 liters of oxygen per minute. So you can understand the amount of oxygen that we consume per patient, right? But we have put a lot of contingencies in place to make sure that we have adequate supplies of oxygen.
We've never run out of oxygen.
We've never run out of oxygen. So, we have been working on this, and we have been expanding our capacity and working to make sure that, patients who do come to us, that they can get good quality care. And that's what we have to keep working on.
You're satisfied that they are getting quality
They are
care?
getting good quality care.
How much of a challenge it has been to you, Minister, to operate in such a dramatically dangerous pandemic with extremely archaic legislation?
Yeah, well, look, it's what it is, and it's not only us. Every country in the world is battling with COVID. I think what we have to do, if we really want to exit this as a country, we have to work with each other. We can't keep you safe if you're not keeping yourself safe.
My thing was about the legislation, because that kind of binds you to how much you can do.
Well, I mean,
it is, after all, a 1934 piece of legislation.
The old public health ordinance is very outdated, but nevertheless, there are sections of it that we've used to do the act. We are right now. We are in discussions with PAHO to update that public health ordinance. To make a more modern piece of legislation. So that's a work in progress. But while we do that, and at some point we will go to the Parliament to pass it, while we do that, we still have work to do. So we can't stop, to fix that and then come back to try to deal with patients' health. We have to prioritize. And the priority right now is to make sure that we can treat people, and we got to try to prevent the disease from happening, which is where the vaccination comes in.
Some time ago, Guyana received a field hospital from Qatar, and you were quoted in the media, Minister, that it will only be set up when the need arises. Given the current situation, has that need not arisen?
Not yet.
How far are we from there?
We're looking at it as a contingency, but we're not there yet. As I said to you, we have 118 patients right now at Ocean View, and we can accommodate 204. So that's, and we, on a daily basis, we look at capacity.
Yes.
We also have capacity at the West Demerara Hospital. We have capacity at Soddy. We have capacity at Linden. We have capacity in Maikoni, capacity in New Amsterdam Hospital, in Skeldon. We have some capacity in Lethem, in Maruka, in Mabaruma, and in Madhya. So we have been regionalizing how we manage some of our patients, and if they really get sick, we bring them down. And so that has helped us in how we are coping with capacity. If there are more people coming in and we see the need to set it up, then we'll set it up. But at this point, we don't think we are there yet. But we have made those contingencies if we need to set it up.
Would we have the human power to do so?
To put up the field hospital, it doesn't take much. It's
No,
the
but to
physical
manage
thing.
it
But
on
to
a-
manage it, we'll have to redeploy people. And like with everything else, if you have limited resources, you have to prioritize it. And so that's something that we've also discussed. If cases go up, what are the triggers and the contingencies that we'll have to put in place?
The private cost of treating COVID is frighteningly prohibitive.
Yeah.
I've got a good friend, you would know the person as well, I would name him. $150,000 a day, he was asked, and to make 3 visits. Why is this?
Privately, not
This is exploiting
so.
a national
So right now,
Yeah, situation.
right now, a lot of private hospitals are not taking in COVID-19 patients. So anybody who gets sick with COVID and requires hospitalization, they have to come to the public system, because no private hospital is taking in any COVID-19 patients. So it costs a lot of money to manage these patients. As I was explaining to you with the cost of oxygen, how much is being consumed. Remdesivir, for example, the antiretroviral, that on average might cost maybe close to $100 a vial. An average course for a patient is
100, not the $100.
100 US, and it would be 10 vials, $1,000 US, right? When you look at other medication that would be needed, you have somebody on a ventilator for 2 weeks. You know, all these things add up. And plus, if they are intubated, we have to give them special types of food to keep them alive. You know, so there are a whole host of other factors that come into play. It is a very costly thing to manage a patient with COVID. At a minimum, we are spending maybe about 5,000 US per patient. Now, think about it this way. The highest cost for 1 dose of vaccine is probably $20 US. 2 doses, $40. Right? So with $40, you prevent you from getting into the hospital. And it prevents the taxpayers from spending
25 times more.
you know. So, but again, these are the challenges that we face. So we really do hope that people understand the consequences of what is going on here and take the vaccine.
One of your parliamentary colleagues from the other side of the table is leading some of this anti-vaccination story, and whether the government is overreaching and acting autocratically, unconstitutionally, etc. Doesn't that justify a full debate in the National Assembly on this pandemic?
We are not shying away from a debate, and when we went for the supplementary budget, because we had to go buy vaccines, I actually thought it was a no-brainer that we are buying these vaccines. And the members of parliament on the opposition side asked me a whole set of questions. It lasted for about 2 hours. They asked me everything that they wanted to know about COVID, as far as I can, they asked all kinds of stuff. And I took pains to try to answer them, because at the end of the day, I did not want people to leave there with improper understanding of what we were doing. And so more than 2 hours I spent answering questions. But I don't think that was their motive. Their motive was to try, they're seeing something sinister in all of this. And there's nothing sinister. The way that the world is managing COVID, you know, you got the health things that you have to put in place. There are vaccines that are available that is going to help people. And these are all standard things, right? So this is not the time. This is not the issue for us to fight over. Because if people are hesitant, and if people are confused, and if people don't get vaccinated, people are going to get sick. Some of them are going to go into the hospital, and some of them are going to die. It's as stark as that. You know, and therefore, what we need now is responsible leadership. So whether you're in opposition or you're heading an NGO or whatever it is, it's responsible leadership. We all have to step out and encourage people that we can influence to take the vaccine. The fellow that you mentioned, I don't know if it's the same fellow in Region 10, but look at Region 10. Region 10 has the lowest vaccination rates, right? We are seeing people from Region 10 who are going into the hospital with severe COVID. We are seeing people from Region 10 who has been hospitalized who are dying. How much more you want to see?
Is it an issue of such magnitude that maybe the President should address the National Assembly on this matter?
Well, the President did have some presentations to the Guyanese public.
Yes.
He spoke, I think, about 2 or 3 occasions where he spoke about COVID and the impact and so forth. But I guess, you know, when we resume, that might be one of the things under consideration. But again, you know,
you can only say so much.
Everybody need to add their bit so that we can encourage people to get vaccinated. That's what it comes down to. Look, I was extremely happy when I saw the Roman Catholic bishop issued a statement encouraging Catholics to go get vaccinated because he understands the importance of that. The Pope spoke about the importance of vaccination. So there were people in the Christian community where there were lots of myths that were being peddled, and this is the mark of a beast, the vaccine. And I'm so happy that a lot of responsible Christian leaders have stepped out and said this is not so. It is important for you to go and get vaccinated. And we need more voices. We need more voices. I've seen similar things from the Muslim community. The CIOG has issued such a statement encouraging vaccination. I've seen that from the Dharmic Sabha. They have come out with a statement encouraging Hindus to go take the vaccine. So everybody can come out and encourage people, and we need that. And what we are saying at the ministry level, look, if you want to organize a vaccine drive in your constituency, in your organization, just contact us.
And the task force is there.
And we'll work with you. We'll, try to bring those vaccines to, your organization and so forth. And a lot of business organizations have taken up this opportunity, and we have collaborated with them. We've done collaboration with some of the banks. We did with Banks DIH, we did with DDL, some of these bigger companies, and there are many more that we have worked with. And we have done these vaccination drives, but we need more.
Yeah, I must say I can attest to a couple of those where I was asked, can you assist in organizing? And the response was almost immediate. Yes,
Yeah.
Tell us where. Minister, as a public health issue, it's also, and I know now may not seem to be the best time to talk about disparities of income and so on, but is the risk of COVID as much a socio-economic issue as well?
It is, because in a lot of countries where they had shutdowns and so forth, people lost their jobs.
Yes.
And it pushed a lot of people in poverty, right? So some of those lofty UN goals that were set for us to accomplish in 2025, 2030,
yes,
and so forth, we're not going to make them. Because instead of reducing poverty, COVID has pushed a lot of the world's population into poverty.
Yes.
So you have that, and in every country it translates differently. We try to strike a balance between having economic activity so that people can earn, and at the same time trying to balance some of the public health measures. But in other countries where they had strict lockdown, as soon as they open up back, you see surges of cases, and it really damaged people's pockets because it pushed a lot of people into poverty. So we have to continue to look at that balance and to see how we can help people. So look at the consequences. You have the health consequences. You have the economic consequences. You have the education consequences. And there are other social things, because when people were staying home, you had domestic violence, you had all kinds of other issues that came about. And it shows that this thing has such a profound impact on societies that we have to come at it with different perspective, but it got to be a united fight too for us to push COVID out of the country.
I see time is coming up on us. I've seen a couple of reports recently, horrible treatment, and I saw the thing about fever grass. Is there any scientific evidence that any of these herbal treatments work?
Not that I'm aware of, but again, what we have to do is follow the science. We know, for example, that one way of reducing the severity of the infection is vaccination. You have several vaccines that are currently available. If you get sick, you got things like the antiretrovirals that can be used, remdesivir being one of them. Depending on the stage of the disease, you can use steroids, you can use, if it's available, you can use the monoclonal or polyclonal antibodies. So for different stages, there are specific medications that are available. And that's how you have to treat with it. Now, things like bush medicine and whatever people want to use, they have, as far as we are aware, there's no scientific basis for them, and it's not going to help you. So you're just fooling yourself if you believe that you're going to use this and it's going to cure you from COVID. So just do the right thing. Why would you want to go use bush medicine when you have a proven medicine in a vaccine? Right?
Provided by the state.
And it's provided free.
Minister, I would love to invite you again when if you could come and say, look, we can declare mission accomplished. I think we're probably somewhere from there, but I do want to assure you, you or any member of your team would have open access to Plain Talk at any time. This program does support vaccination. It recognizes and advocates absolute belief in the science. There's no substitute for that. So on that note, I want to thank you very, very much, to congratulate the members of the task force and the team. I do believe I've witnessed some of the excellent work that they've done. So I want to say thank you very much for spearheading that type of initiative.
Well, thank you very much for having me, and thank you for your generous offer. We always welcome a chance to, get information out to people, and I think by using your program to talk to your viewership, I hope that we have been able to at least not convince a few persons that they need to get vaccinated. If they themselves have been vaccinated, they can help us to encourage others to go out and get vaccinated, because we are all in this fight together, and if we want to exit the pandemic, we all got to be vaccinated. So thank you very much.
You're most welcome. Operators and viewers, thank you, good night, see you next week, and please take the advice from the Minister. Go and get yourself vaccinated. If you've had your first dose, it makes absolutely no sense for you not to complete that second dose. So please be guided by the science. It is in the interest of your health, it is in the interest of your neighbor's health, your family's health, and the interest of our country, which must certainly be paramount. On that score, thank you and good night.
You're sorry for all the wrongs that you have done. I don't want to hear sad story, 'cause the damage already done. Oh, the damage already done. Broken bones and wounds need tender repair. Hang on, brother man, don't despair. Although we forgive 7 times 7, still the damage already done. So much damage already done. Stop and listen a while to meditation style.